What do you mean when we talk about hormone imbalance?
Well, particularly we're talking about hormones related to sexual health, fertility, and well-being. And those are when we're talking about women, the ovarian hormones, estrogen, progesterone, and testosterone. Thyroid hormone, adrenal gland hormones, there's a bunch of other ones. But when we talk about hormone imbalance, we're particularly referring to those. And as women age, starting between the mid to late 30s, early 40s, that's when those hormones start to fluctuate and then decline and can cause severe symptoms.
How do these hormones impact female sexuality?
They are, I would say, once you've ruled out emotional relationship issues, situational problems, things, the stress related stuff. And if we're just talking about medical causes for sexual function complaints in women, and we've ruled out all the other stuff, hormone imbalance is probably at the absolute top of the list as a cause for sexual function complaints in women. And the symptoms related to hormone imbalance can be vaginal dryness, painful intercourse, difficulty achieving orgasm, low libido or lack of interest in sex, difficulty achieving orgasm or inability to achieve orgasm. All of those things are impacted by hormone imbalance, not to mention energy, sleep,
right,
mood, all those other things too. But when we are asking about sexual health, that's how it plays out.
Now, those particular hormones also impact a woman's sexual response as well.
Yeah, sexual response in terms of arousal, so lubrication, sure, warmth, tingling, engorgement in the genital area. Yes.
Now, how common is such a condition within women? You talked about as they age. Around what age do they start noticing some of these facets and should possibly speak to a professional?
That's a really good question. And I've been asked that a lot of late, which is a good thing, because to me, that means that people are starting to talk about this topic, yeah, and women are starting to look for answers. And it's tricky because the symptoms start in what we call perimenopause. So that's women in their mid to late 30s, early 40s, and they can be subtle and they creep up kind of slowly and insidiously and can be easily written off and blamed on other things like stress. Okay. Or my husband, I feel this way because, we've moved, to a different state, or my mother died, or my son is, got a DUI, or whatever, all the things that distract us and take away our attention and cause us stress. We make excuses for how we feel. And it's important to be aware of the changes that are occurring in your body, assuming even in light of all the outside factors that impact us. And low libido, lack of interest in sex or diminished interest in sex, vaginal dryness, changes in arousal, orgasm are usually a first sign. Yeah. However, other things will also be going on that can cause you to think, well, maybe something else is going on, like difficulty falling asleep or staying asleep, changes in your mood, becoming worsening PMS, problems with weight gain, maintaining your weight or losing weight is a huge complaint that women have. Focus, concentration, memory changes, that they have more short-term memory changes, difficulty retaining information. All of that in combination with the sexual function complaints, can occur. And so maybe you're just having a little bit of vaginal dryness, but also are super fatigued, not sleeping, right, really moody. So those would be, red flags that perhaps there are changes going on with your hormones. And then you throw stress into the equation, like COVID, by the way.
Sure.
When in the throes of COVID, that was putting women that were premenopausal into perimenopause. Perimenopause, we're going into menopause. So stress will impact your hormone levels.